You're listening to Protocols in Action with Researched Nutritionals.
I am Dennis Schoen, and I'm the founder and CEO of Research Nutritionals. As the company was founded to develop targeted nutritional supplements and completing clinical research that is published in peer-reviewed journals, part of our company mission is to promote practitioner education with talented and creative practitioners such as today's guest, Doctors Christopher Wakely, who practices in Seattle, and Dr. Debby Hamilton, who founded Holistic Pediatric Consulting in the Denver area. Dr. Wakely is a fully licensed naturopathic physician, completing his naturopathic medical education at Bastyr University. He works with patients experiencing complex chronic health challenges who have typically seen between 11 and 17 physicians before seeing him. His focus is on environmental toxicity, whether from metals, mycotoxins, chemicals, as well as patients exposed to vector-borne challenges. Dr. Wakely also delves into and works with patients who are dealing with the impact of autoimmune and mast cell issues. He's a member of the clinical faculty at Bastyr University and has received a variety of postgraduate training, including NESH, A4M, the American Academy of Environmental Medicine, the International Peptide Society, and others. Switching over to Dr. Debby Hamilton, she is a board-certified pediatrician and also has a master's in public health. She is certified in physician nutrition, integrated holistic medicine, and functional medicine. Dr. Hamilton received her medical degree with honors from the Chicago Medical School, Rosalind Franklin University, and completed residency training at Brown University's Hasbro Children's Hospital and the University of Massachusetts. She also completed fellowship training in pediatric nutrition at the Children's Hospital in Denver. Her training included nutrition from lactation issues to adult chronic disease. Her patient population includes those on the spectrum, mood and behavioral disorders, and has authored the book Preventing Autism and ADHD, Controlling Risk Factors Before, During, and After Pregnancy. Dr. Hamilton is Director of Physician Education and Clinical Trials at Research Nutritionals. Today's discussion is focused on mental wellness, as the need to address this critical issue cuts across all walks of life, and the need seems to be growing exponentially. Our two guests are here to share their specific approaches to dealing with the underlying issues. And Dr. Hamilton will also share some new research on cognitive nutritional support that was just published in the peer-reviewed journal, Current Nutraceuticals. To our listeners, as you heard Gina say, we'll have a live Q&A following, so please go ahead and during the session, enter any questions you may have, and we'll try to answer as many as we can get to. So at this time, I'd like to turn this over to Dr. Wakely.
All right. Can everybody hear me? We're good? Well, thank you, Dennis. That was a great introduction. And Dr. Hamilton and I are super excited to be speaking with you guys tonight in partnership with Research Nutritionals and A4M as we discuss some factors that are impacting your patient's cognition, anxiety, and stress, and then obviously discuss treatment strategies for your patients, and then talk about the hot off the press peer-reviewed published data that Dr. Hamilton and her group just concluded, which I can't wait to hear more about. So with that, we're gonna jump right into it, and I'm just gonna go over some statistics here. I'm gonna keep it pretty brief for you guys. But when we're looking at cognition and then the stages of cognitive impairment, what we see is you start with normal cognition, and then that can decline into subjective cognitive impairment, then mild cognitive impairment, and obviously dementia. And I don't know about you guys, but probably about 70% of my patients, when I ask them about some of these symptoms, which we'll talk about in a second, that are associated with subjective cognitive impairment, say that they have them. And I see all age groups, cradle to grave. So subjective cognitive impairment isn't a diagnosable condition. It's not in the DSM-5. And right now it's not verified by standardized testing. So really what we're looking at is we're looking at symptoms, which include increased forgetfulness, what we call the tip of the tongue phenomena, losing your train of thought, feeling overwhelmed when you're making decisions or having to plan things, and then obviously depression. And, I don't know about you guys, but gosh, there's some days where I feel like I have subjective cognitive impairment. When we look at some statistics, this was a 2013 paper where they used those symptoms that we just discussed. All age groups reported some form of subjective cognitive impairment, even in younger people from ages 18 to 39. And then if we move into anxiety, we see that 12% of Americans at one point or another have been diagnosed with generalized anxiety disorder. I asked my children last week, I have 2 daughters, and I asked them, hey, how many people in America do you think have anxiety? And they both said 60%. And that's definitely true, with situational anxiety. And I think that if these studies were to be replicated or redone again now, especially post-COVID, that we would see definitely a bigger uptick in the diagnosis of anxiety and subjective cognitive impairment. And then what about stress? This was a very recent publication that just came out from the APA, the American Psychological Association. They polled 3,000 people, and 24% of the 3,000 people rated their stress at either an 8, a 9, or a 10 out of 10. So it's definitely impacting everybody in America. And the good news is that there is a lot that we can do about it. So health impacts of anxiety, stress, and cognitive impact. And these are the things that a lot of our patients are coming in and they're actually complaining about. You'll see sleep problems, weight gain, withdrawal, isolation, an increased tendency towards undesirable behaviors, blood sugar issues, and then GI dysfunction. And I think the thing that's really interesting is that when we're talking about blood sugar dysregulation and insulin resistance, we've got to remember that glucocorticoids like cortisol and then catecholamines like epinephrine and norepinephrine are definitely going to affect the body's response to uptake glucose into the muscle cells. And, we all know that cortisol, epinephrine, and norepinephrine are kind of a natural response to stress. And then the other thing that I would say on this slide, I'm not going to belabor it too much, but when we are in a stressful situation or experience a stressful event, the brain releases corticotropin releasing hormone, CRH, which is going to cause mast cells in the blood vessels to degranulate. And those proteases that get released from the mast cells are actually going to degrade those tight junctions that we talk about all the time in the small intestine from the basal side of the cell. So we definitely got to keep those things in mind when our patients are coming in talking about glucose dysregulation and GI dysfunction, which, is a lot of our patients. On the right-hand side of the screen, you're just going to see some causes. That first column from Alzheimer's all the way down to B12 and folate deficiency, that's standard of care medicine. You can go on UpToDate or Dynamed or anything like that, and those are going to show up when we're talking about anxiety, mild cognitive impairment, things like that. The things on the right-hand side of the screen, hypertension, diet, heavy metals, infections, medications, GI issues, those are the things that primary care providers, most of them, they don't have the time or the resources in order to be able to talk about those things. And I think that in holistic medicine, that's where we as practitioners can really shine. These next two slides right here are really just for your reference. I pulled both of these off up to date. These are some medications that can cause cognitive impairment. And there's some heavy hitters on here, right? Like opioids. But right above opioids is something that a lot of Americans take all the time, which is NSAIDs. I think it's something that we really don't think about enough and definitely needs to be brought into the conversation. And again, just for your reference, some medications that can cause anxiety. Okay, heavy metals. If you guys have ever heard me speak, you've probably heard me string those two words together, heavy and metals. I talk about it a lot because I feel like it gets ignored. I'm not going to spend too much time on this because this really is probably a full weekend for me to talk about even two or three of these. But I do just want to bring your awareness to a couple of these. The first one is arsenic. So arsenic has been termed the silent pandemic in America. 25% of sampled water systems in the United States exceed the limit of 2 micrograms per liter. And we know that in even moderate exposures of arsenic, people can have lowered cognition, lowered processing speed, and memory issues. And then if we look at iron, which, we're always looking at in males and in females, we know that that's a really finicky one, right? If it's too low, people can have cognitive issues. And if it's too high, they can also have cognitive issues. Infections is something. I'm not going to talk about COVID tonight because that's been talked about to death. But I do want to call your attention to something that I found really interesting about the herpes virus. And some of you may know this, but herpes actually upregulates the production of amyloid beta. This was in vitro research. And researchers think now that upregulation of amyloid beta is actually a protective mechanism against HSV. And they're doing further investigational research with amyloid beta in response to other pathogens like certain fungi and bacteria. Lyme disease is another one that can definitely cause anxiety, can definitely cause mild cognitive impairment, anxiety, depression. This paper was just really more for your reference here. Okay, inflammation. So we're all talking about inflammation. We've been looking at it for a really, really long time. It is a super big deal for people. And one thing that I think is super interesting is that we're talking about it, but in a sense, we're almost ignoring it too when we're thinking about it in the context of mild cognitive impairment, stress, anxiety, and mood problems. And we know that inflammation plays a big role in cognitive impairment because there's an inflammatory subtype of Alzheimer's disease. And there's a researcher at UCLA, he's a neurologist, his name is Bredesen, and he actually came out with a study pretty recently that looked at the correlation between elevated interleukin-1, CRP, interleukin-6, as well as a low albumin to globulin ratio, which we're all running because most of us are doing CMPs on people, and how those things are correlated with cognitive impairment and also vascular dementia. And then elevated cortisol. Oh my gosh. How many of your patients come in with an elevated cortisol? We know that elevated cortisol is going to increase the atrophy in the hippocampus, which is going to progress cognitive impairment. And then that's also associated with a whole bunch of things, right? Like poorer episodic memory, poorer cognitive function, problems with language, increased tip of the tongue phenomena, which luckily I don't have tonight, spatial memory issues, processing speed, and mental confusion. I mean, all of these things give rise to various degrees of cognitive disorders, but also mood disorders that, impair everyday functioning and then the quality of life for our patients. So this is a case study. This is a patient that I have, 38-year-old female, 5'4", 185 pounds. She presented to my office. Her chief complaints were fear, stress, rashes, severe brain fog, and then deep fatigue. And really, when she came in, it was the deep fatigue that she was the most concerned about. She actually had to move back in with her parents because her symptoms were so bad. And she'd seen, 6 or 7 doctors before. She was doing cognitive behavioral therapy for like 6 months and had some improvement with that. But, it was pretty minimal. Sleeping 15 hours a day. She tried all the diets. I was like, well, what have you done? All of them. Done all of them. Did keto, did paleo, did autoimmune, did this, did that. And then the answer from the last physician that she saw was a prescription for clonazepam, but that actually caused her to have panic attacks, which, she took 1 dose of that and then was done. So I ran some basic labs on her. They were all within normal limits, except for the following. Her fasting insulin was 43. So I don't know if you guys are running fasting insulin on your patients, but I think that's a really good marker, not only for glycemic issues, but also inflammation in general, right? Insulin's anabolic, so it's going to get upregulated in the presence of inflammation. Her morning cortisol was 26, and I listed the reference ranges there in parentheses for you guys, just in case. This was LabCorp testing. Quest is pretty close to in terms of reference ranges as well. Her high sensitivity CRP was 35. This is not a patient who had hypertension, no family history of cardiac issues. Her alpha or albumin globulin ratio was low. She had elevated plasma aluminum at 18 micrograms and elevated arsenic. And then her oxidized LDL was 946. And I just put a note there. I'd like to see that below 60. So I ordered some additional testing to make sure that we didn't have an adrenal issue going on. That all came back normal. I did an OAT on her, an organic acid urine test, and those were the markers that came back abnormal. She had elevated methylmalonic acid and elevated HVA, so problems with the dopamine access. Low pyridoxic acid, so that's vitamin B6, and then high quinolinic, which is very inflammatory. So if quinolinic is high, they're not converting tryptophan to serotonin via that 5-HTP access. And I think I have a slide on that later. And we'll get back to what I did for her towards the end. But right now I want to move on to some treatments. And I always like to start with the free stuff. So what are things that you can tell your patients to do that aren't going to cost them, a whole bunch of money? So the first one is diet. I think anti-inflammatory diets in general are really good. I like the well-formulated ketogenic diet for a lot of patients, not for all patients, but I think in general, when we look at the data on the ketogenic diet and its ability to help down-regulate some of the inflammatory cytokines like NLRP3 and some of the other ones, I think it's really helpful. And then either a fasting mimicking diet or intermittent fasting can be super helpful, because with both of these diets, what are we trying to do? Well, we're trying to down-regulate inflammatory markers. So with these, you're going to upregulate AMPK, you're going to down-regulate mTOR through that reduction in insulin signaling and IGF-1 signaling. Lifestyle modifications. I chose cold thermogenesis, or cold plunges or hydrotherapy or whatever you want to call it. I very easily could have talked about sauna on this slide too, but I've been doing cold thermogenesis for 12 years. I'm a big fan of it. Every day I start my shower with 2 minutes of cold water. And I put the PubMed ID on this slide just so you guys could look this paper up. There's a lot of papers now coming out on cold water, but this paper was interesting. It triggers that ribose-based membrane protein 3, RBM3, which forms at the end of dendrites and can protect the brain from cognitive impairment. And cold water, although it sucks, nobody likes getting in cold water. It's free, and it's something that you can do to empower your patients. What about exercise? Well, if patients are short on time and they have the chutzpah, the gumption, the oomph, in order to be able to do some high intensity interval training, that can be really, really good for increasing blood flow to the brain. And HIIT, high intensity interval training, is going to raise lactate levels, which is in turn going to increase BDNF. So most of us, when we hear lactate, we think, oh, that's a mitochondrial problem. Oh, that's not good. And in some situations, that's true. But in the case of exercise, getting some lactate into the brain can be actually really helpful. And if your patients don't have time to do HIIT, if they're working all the time, tell them to do exercise snacks throughout the day. So run up and down the hallway for 30 seconds, do jumping jacks or high knees or something like that. Even that minimal, in terms of time, that minimal increase in heart rate can be really, really helpful for cortisol, stress, anxiety, all the things that we're talking about tonight. What about our chronically ill patients? Can moderate exercise help? This was a really good paper that looked at, I think it was like 7,000 or 8,000 patients who were over the age of 50. And what they found was those who exercised even 10 minutes a day were 47% less likely to experience anxiety than patients who didn't do anything at all. And I think what's going on here is, as we age, those cells that line the blood vessels in the brain, called pericytes, start to detach. And when you're increasing blood flow, even with minimal exertion exercise, you're going to improve that vascular blood flow and keep those pericytes from detaching as quickly. So tell your patients to at least get out for a 10-minute walk if they can. Sleep and stress management, also very important, especially for cortisol balance. Blue light, you want your patients getting blue light in the morning, have them go outside, look at the sun, do it again in the afternoon, because our brain, through the melanopsin receptors in our eyes, actually responds to the wavelength of the sun, and it kind of helps regulate our circadian rhythm. And then at night, you gotta get off the phone. We gotta turn the TVs off, or you can be silly like I do and wear blue light blocking glasses that I got for $3 at Home Depot. They're just orange safety glasses, and they work really well. Definitely got to deal with infections and heavy metals. This is my bias because I'm an environmental medicine doctor, so I'm always looking for infections. I'm always looking for heavy metals. Chelators are going to reduce the levels of deposition of amyloid beta, and the PubMed ID is on that slide. Okay, supplements and nutraceuticals. So the question you got to ask is, what are you trying to do? Well, for this webinar, we're trying to improve cortisol, reduce inflammatory markers, increase BDNF and neuroplasticity, and then, subjectively improve their symptoms, reduce the tip of the tongue phenomena, improve their mood, improve their stress response, help them balance their serotonin and their dopamine, and then improve GI function, plus all the other stuff that they're coming in and complaining about. So this is where I get super pumped about BDNF. And I have been yakking about BDNF and anxiety ease, especially the combination, for a couple years. And I think the first time I met Dennis, the first thing out of my mouth was, I love the combination of BDNF anxieties. And I feel like they are synergistically just super legit. They're like a power couple. They're like Ben Affleck and J-Lo. You put them together and, it's just like completely unstoppable. BDNF is backed by, clinical research, which Dr. Hamilton is going to talk about. But both formulas are really, really good. So there's a couple things I want to highlight on BDNF, and then I'll turn it over to Dr. Hamilton so she can dig a little bit deeper. But we've got the ingredients up here on the screen, and sometimes people look at these ingredients and they're like, okay, I've heard of that. Okay, that makes sense. The things that I want to draw your attention to are the CDP choline, which instead of just using regular choline, Research Nutritionals uses the CDP choline, which has way better bioavailability. So if you're trying to promote the turnover of oxidized or toxic cell membranes, then you're going to want to use CDP choline. BDNF Essentials also has ashwagandha in it, which, there's a ton of literature on ashwagandha. I love it for all sorts of things, but we know that it decreases NF-kappa B, which is, associated with all sorts of bad things. It reduces cortisol levels. And then you've got bacopa in there, which we know is really good for memory, but bacopa also activates NRF2, which is super important for neuroplasticity, and a bunch of other things too. So with all of these things combined, I can't guarantee it, but I have seen it clinically in my patients. They will come in and they will say, yeah, my brain works better. My brain is working better. And when they have subjective improvement in how they're doing, or their spouse or their partner comes in with them and they're like, oh yeah, he's better or she's better or whatever, then, that to me is research in and of itself. So I absolutely love this product. And anxieties, I took like 12 of these before this webinar tonight. No, I'm just kidding. I'm a joker. So like I said, I use both of these together. And the thing about anxieties is, I've been giving theanine and glycine and CBD and, kava and GABA and all of these things. And in some patients, they can be really helpful. But the thing about anxieties in my clinical experience is that it is calming, but not sedating. That's the problem with a lot of these anxiety formulas or formulas for mood and stuff like that, is that it will dope your patients out. And if they're already having cortisol dysregulation, if they're already super stressed out and they're not sleeping and they can't lose weight and all these things, the last thing you want to do is give them energy problems or more cognitive issues because you're essentially sedating them, whether it's with natural stuff or pharmaceuticals. So I love this product, but I love these two together, this combo. So P5P, super important for serotonin production. And you can see here on this slide, you need vitamin B6 in order to convert to serotonin. And I put the PubMed ID there. And then anxieties also has the holy basil leaf extract in it, which has been around for 5,000 plus years. The Ayurvedic medical doctors will call it the incomparable one. There's a whole bunch of data on this, but we know it lowers cortisol levels. It can improve stress response. It's neurotropic. It improves blood sugar. And then the other cool thing is that it's also super high in rosmarinic acid and apigenin. And if you guys heard my talk in October at A4M, I talked quite a bit about apigenin and rosmarinic acid and how helpful they are at regulating the histamine response and making it so mast cells don't degranulate. So there's really a lot of benefit to both of these. Okay, I'm going to go back one and we'll turn it over to Dr. Hamilton. I'm going to stop sharing my screen here, Dr. Hamilton, and then you can share yours.
Unmute. Yeah, I'm sorry, I just going to say you are muted, but thank you for unmuting.
Yeah. Okay. All right. Can everyone see this? Is this good so far?
Perfect.
That's a yes. Okay. So I'm going to kind of talk about the BDNF Essentials research, but also I helped develop the BDNF Essentials and anxieties. So some kind of clinical uses. I said there was some great background, Dr. Wakely, so thank you very much. But kind of go through some of this. I'm a pediatrician, so I treat a lot of kids. I do a lot of autism, ADHD, a lot of mood, behavioral issues. So as I said, some of this is like, wow, I'm like developing things that I want because I want to use this, because I need this, right? Because this is something we really need. So just a little bit of background. And I studied this. This is really kind of anxiety levels and looking at how severe, moderate to severe. And again, in my age group, which is now in their 20s and 30s, kids, but a lot, like those younger people they're really in bad shape. This was pre-COVID. And then kind of post-COVID, especially this really young group, which even includes kind of my kids are in this age, really significant anxiety and depression. I mean, these kids were really falling apart. And so I think that these were actually, anxieties was actually developed during COVID because we realized this was such a significant issue. So I like this. This is physicians, but this goes for all practitioners and nurses here. I think even worse, just the amount of burnout and the amount of stress and anxiety, just even with us as caregivers. So risk factors for anxiety and depression, obviously stress is the huge one, and social stresses, family, children, relationships, people, isolation, as I said, the burnout, the trauma, understanding a lot more about trauma, genetics. We're going to talk about BDNF and BDNF Essentials. There's actually BDNF SNPs that influence your rate of, increases your rate of depression and psychiatric issues about 30%. Any kind of chronic health issues, chronic Lyme patients, you got underlying inflammation, talk a lot about mitochondrial dysfunction and kind of brain function, but diet, smoking, drugs, everything that Dr. Wakely mentioned in terms of physical activity and diets and basics. Obviously, COVID did a really number on us. The rates in females are higher than males, and that would probably be a whole separate discussion, a sociologic discussion. So when you think about stress, we have all the stress, we have anxiety, but we also have so many symptoms of health symptoms. And this kind of comes into all of our cognitive symptoms, our brain symptoms, which is why the BDNF goes so well with anxieties. But, the people who have like the fatigue and the headaches and the fast heart rate and all these different symptoms, which also sets your body up for blood sugar, metabolic issues, GI issues, these are all what we see in chronic medicine. So anxieties, and I said, I love how he talked about some of the adaptogens. Holy basil is an amazing herb. Ashwagandha is one of my favorite herbs. And I said, I designed that. So I'm not going to talk about that as much. I am going to talk a little bit about the cerebiome, the whole gut-brain connection. So when I designed this, I really wanted something that modulated cortisol. So you think about the adaptogens, right? The holy basil, the ashwagandha, that really help with stress, right? So think about kind of the long-term helpful balancing of the cortisol, helping with the stress. But I also wanted something that, is going to help you right away. When people are anxious, I'm like, I want to wait a week, right? They want to be able to function now. They want to take that anxiety down and be able to function. And so I really looked at, what are these herbs? What are the kind of like some of the inhibitory, really looking at GABA, the kind of long-term, as he mentioned, the P5P in terms of serotonin production. A lot of herbs, you think of most of the herbs we use in integrative medicine are anti-inflammatory, and that's part of their action. And then the whole gut-brain axis. The gut makes so many neurotransmitters. And then we know the vagal nerve and the kind of the vagal nerve responses and the circulation. We really need to kind of address that component to it. So GABA, the primary inhibitor neurotransmitter in the brain, it definitely decreases neuronal excitability. It balances that glutamate, right? Excess glutamate, think about the excitatory neurotransmitter. So this is what is kind of acutely helpful for stress and anxiety. And if you think about some of our prescriptions, like the Valium, the Xanax, those are actually targeting GABA. So we're really trying to do herbs that are naturally supporting GABA. So the Cerebiome is a patented form. It is 2 different probiotics that have been researched, and they're researched together. And again, we're really targeting the gut-brain axis. And again, you think about the circulation. What are the connections? The vagus nerve. Here are the neurotransmitters in the gut, metabolites. Think of all the inflammation of the immune system. How much of the immune system is actually in our gut? And so if we're getting those good probiotics in, we're managing inflammation, we're managing the neurotransmitters, right? So it's a really big connection that I think is really important to understand. And looking at the specific kind of combination, there's a lot of research on it. And I'm going to talk about one research study, but in the end of these slides, there's actually a listing of several different studies. So this looked at, and my sharing screens blew it, looking at Cerebiome and kind of looking at, obviously placebo and thinking at more severe depression, right? And so if you're thinking about it, and you always, when you have the stars, that's a statistically significant improvement. So if you look at with a Cerebiome, the significant decrease in depression, I think that's over 2 months. And that's just using one component. And that's thinking of kind of the long term. So when I thought of anxieties, as I said, if somebody's anxious, they don't want to kind of wait, oh, well, this will work in 2 weeks. I'm like, well, I need some kind of feeling better right away. People want to feel that decrease in anxiety. So really anxieties, it kind of targets long-term stress, thinking about the adaptogens, the balancing the cortisol response, and then the psychobiotics, that probiotic combination, that's a kind of a long-term management. Magnesium P5P, supporting the serotonin, and then the herbs and adaptogens. But you also want some short-term management. And this is where you have the herbs like the lavender and the passion flower and things that help modulate GABA and serotonin. So you do have a short-term response and improvement, plus really working on long-term. So then if you think about it clinically, it's something that, if you use it twice a day on a regular basis, you're helping managing cortisol. You think about the Cerebiome, kind of helping that gut brain on a basically kind of on a longer term basis. But people are also going to feel that decrease, and that kind of relief and like, okay, take that edge down right away. So that's why, and that's one of the reasons I really like it too. So if you think about it, and this is kind of tying anxieties together with the BDNF, and then I'll talk about its research, which was really, really amazing, especially since it was done with COVID. So you think about studying stress in a really extremely stressful time in history of all things. But if you think of what does chronic stress and anxiety do in the body? And one of the most significant things is it lowers the BDNF. And BDNF is the brain-derived neurotrophic levels. And I'll talk about why that is so important. But if you also stress and anxiety, as I said, you get that raised cortisol. Some of his patients, those are some high levels of cortisol and insulin, and you're looking at those, but that's significant inflammation. This is a 38-year-old woman. So, and then the insulin, unbelievably high insulin, all the metabolic issues, and then the weight gain is associated with stress and anxiety. You've got the decreased mitochondrial function, and that's your energy, your cellular energy. So people are on kind of like this constant fight or flight stress mode, right? With a lower BDNF, which is kind of why these two work really well together. So the brain-derived neurotrophic factor, BDNF, is involved in neuroplasticity. And neuroplasticity is basically the idea that the nervous system can change and adapt. You can get new nerve cells, cells are like, they make different connections, they can change function, they can repair, which is really optimistic if we're thinking about chronic disease, whether dementia or autism, that the nervous system can heal and repair. I mean, as I said, I've been in medicine long enough that I'm like, oh no, you get to a certain point and your brain just dies and all your cells die. It's like, well, then what we're realizing now is that we really can repair and heal and support people, which is, what's such a positive, hopeful thing. And so tying kind of the clinical of what BDNF function does, it's involved in the learning and the memory, the cognitive function, attention, and resilience. So what happens when you're talking about increased stress and anxiety? All of these go down, all the cognitive impairment. So here we are. Okay, well, one of the reasons is the stress, anxiety is lowering the BDNF, which has affected neuroplasticity and affect our ability, causing that quote unquote brain fog. So BDNF essentials, I said he talked about some of these, and looking at, especially in developing, a lot of these herbs have research that shows they increase the BDNF. And that's especially kind of looking at like lion's mane is skullcap, but all of these different herbs. And then again, also trying to modulate, and you talked about the CDP choline, phosphatidylserine, some of those phospholipids. So the study we did, and as I said, this was during COVID. So we, and in terms of studying supplements, you don't study kind of a disease state per se, because this isn't drug research, but you study symptoms. And symptoms, as I said, people want to improve the symptoms. And when we design a study, you want to kind of like, are people getting better clinically? And are the markers that you're thinking of and some of the things you're looking at also improving that correlate? So the objectives of the study was BDNF essentials, but looking at patients, healthy adults with self-reported memory complaints, right? And as Dr. Wakely said, some of those are the first signs of some of the first cognitive impairment. Are people noticing some of those signs? So they had something called a compass system, which is a really elaborate questionnaire, validated studies of memory, attention, processing speed. There were questionnaires about mood. We looked at a lot of biomarkers of stress and inflammation, like cortisol levels and interleukin-6 and BDNF levels. And this was roughly a 3-month study. And again, during COVID, where we're all, super stressed. So I said, this is, so there's A, B, and C here. But these are kind of some of the results, and then I'll give some more summaries. But if you look at, let's see my little marker here. Can you see my marker? Well, I don't know if you can see it, but anyway. So if you look at the top under A, and you look at the first 4 bars. So just for example, psychomotor speed, or look at the yellow one and processing speed. If you look at the yellow bar, from kind of day 30, screening to day 30, and then at day 90, look at the increase in some of these. So looking at psychomotor speed, processing, reaction times. The second column, the B, looking at memory, different types of memory. Look how much the working memory, that's like your day-to-day memory increased. And then even looking at, there it goes, the executive functioning and cognitive flexibility, right? That's kind of what we need. That's executive functioning, that flexibility to think and process and put it all together. So in terms of highlighting, kind of the results were that, and the most significant, there's multiple significant things, but one of the first things that struck me is that there was an improved reaction time. So what I call like processing speed. So how long does it take you to kind of come and kind of basically like solve a problem? And so that processing speed decreased, but the accuracy was maintained. So sometimes people are like, oh, well, I can figure that out more quickly, but I make more mistakes because I do it more quickly. And that wasn't the case. It was actually the accuracy. And everybody's like, wow, that's a big deal, right? Because you're getting better and you're still accurate. One of the other significant was the salivary cortisol significantly reduced. So showing, some improvement in memory and also improvement in cortisol, a lot of mood improvements in interleukin-6. So in terms of conclusion, a 10% reduction in cortisol, thinking about stress, anxiety support, improved memory. I said visual memory, immediate word recall, and mood improvement. And I like how they split some of the different mood issues into improvement in confusion and bewilderment, and depression, dejection. But overall, as I said, improvement in inflammation markers, cortisol markers, which is really significant, especially in such a difficult time, but improvement in mood and actually cognitive function. So I know we're going to get to questions. So this is like my last slide here. Just in clinical uses, really any kind of cognitive dysfunction, right? We've seen some great things with traumatic brain injury, right? If you think about traumatic brain injury in terms of decreasing BDNF, general cognitive dysfunction, as I said, quote unquote aging, but really kind of the stress, heavy metals in our environment, general stress and anxiety, depression, that brain fog that goes with a lot of things, memory issues, attention issues. I do use it a lot, I said, in my kids, but my kind of the mood and behavioral issues, but a lot of ADHD, autism. And I think if you look at autism, it's kind of like a childhood dementia, as frightening as that sounds. Combined with anxieties, I agree that it's great for anxiety, stress support, and stress support. Combined with circadian PM as our sleep supplement. And that's another combination that works really well. And I said, these are some of the cerebiome research studies, and I will take this out of sharing. And I said, I think you have some more to do, Dr. Wick, and then we're going to have questions.
Okay, I'm just going to share my screen one more time. Okay. That was, Dr. Hamilton, that was awesome.
Thank you.
You guys, 41% improvement in word recall. Do you know how frustrating it is for a patient to not be able to find the words? It's so frustrating for them, but it's hard on their family members. It's hard on their coworkers. Other people end up trying to fill words in for them, which can, lead to a little bit of withdrawal. I don't know. It's a really big deal. And like I said, I love these two together. Get 2 bottles and try it on yourself of each and just see. Okay. So I think this is my last, yeah, go ahead. Somebody saying something? No. This is my last slide here. So this was the case study that we talked about, 38-year-old female with all those really abnormal labs and that 10 out of 10 fatigue. So what did I do for her? I put her on a well-formulated ketogenic diet, not a dirty keto diet, a well-formulated ketogenic diet. I kept her total carbohydrate level. I got it down to 50 grams a day over about a month. I started at 200 grams for a week, and then we went to 150 total grams of carbohydrate, not net total, then to 100, then to 50. I had her order a MyTap score. So you can go to mytapscore.com for her well water, and it showed elevated arsenic levels in the well water. So I had her get a filter. I had her get a Berkey filter, but there's a lot of filters out there that are pretty good. We regulated her sleep routine. We did some sun exposure in the morning, and I had her start walking in the morning. And we literally had to start with the 10-minute walk, you guys, because, she moved back in with her parents. So when I frame this with patients, sometimes if you say, I want you to go for a 30-minute walk, that's overwhelming for them. So what I'll do is I'll say, I want you to walk 5 minutes away from your house and then turn around and walk 5 minutes back. And then we just slowly start increasing that way. And if you see patients with complex chronic illness, this probably isn't the first time that you've experienced someone coming back to you and say, I can't do a 15-minute walk. It's too much for me. I had her start cold water exposure in the shower, 10 seconds in the middle. So I call it a cold water sandwich, hot at the beginning, cold in the middle, hot at the end. It's like a healthy Oreo cookie. And then we work up time on cold water. For supplements, I put her on trifortified glutathione. That's pretty much the only glutathione that I use. 1 teaspoon once a day, hold it in the mouth for 60 seconds. Why? For a million reasons. But she had elevated aluminum, elevated arsenic, and we know that her mitochondria is not functioning well. Glutathione's a really big deal, you guys. And arsenic will consume glutathione status. So your reduced glutathione, the intracellular glutathione, will go down if you're exposed to arsenic. And you can reference my slide on arsenic again, but it's a big deal here in America. I put her on a little bit of alpha lipoic acid, 300 milligrams twice a day, magnesium bisglycinate, 240 milligrams twice a day. That's a high dose. She did really well with it. And then anxiety ease, 2 caps twice a day, and BDNF essentials, 2 caps twice a day. 3 months later, she followed up. Stress, still high, but way better than I first saw you. That's what she said. Her fatigue went from a 10 out of 10 to a 6 out of 10, and she started walking 3 miles a day. I was like, 3 miles? Are you sure? Miles? Yep, miles, Dr. Wakely. I was like, holy crap, that's amazing. Her fears subsided, a lot of irrational fears, and then brain fog went to a 3 out of 10. And her mother, who came with her to the initial visit and then to this follow-up, said that, she can actually form sentences again. It's a thing. She's back. So, I guess I'll turn it back to you, Dennis.
Wonderful. Well, thank you both, Dr. Wakely and Dr. Hamilton. It's great information that you're sharing and useful information for practitioners. And as a result, we do have a good number of questions here. So let's go ahead and get started on some of this. One of the questions is, what are the SNPs associated with depression and anxiety that were mentioned in one of the earlier slides? I think this question may have come in when Dr. Hamilton was talking, but either of you can answer.
Yeah. There are SNPs in the BDNF SNP. I think it's the ValMet. It's about 30% lower, increased risk of depression, bipolar. If you have COMT, that influences your neurotransmitters. So that has a lot of mood issues. Even MTHFR, you can see mood issues. You think about folate status, as you mentioned, folate and B12 status, MAO. There's a lot. If you affect methylation, anywhere in the methylation eventually can go into that. But I was kind of talking, if you were talking really specific BDNF, the BDNF SNP.
Okay, thank you very much. Another question. Can BDNF essentials be taken alone with similar benefits for anxiety, mood, and attention, or does it need to be taken together with anxieties for full benefit?
Do you want to answer that, or?
Yeah, well, I'll weigh in. No, you don't need to take them together. BDNF essentials works by itself. Anxiety ease works by itself. I am just a proponent of pairing them, but you certainly do not need to take them together.
Wonderful. How young could you use BDNF essentials for?
Safely, you have to do it dose. But you can use it down to like age 2. If you're doing kind of 2 to 5, you could do like 1 capsule. Honestly, pretty safe. So especially I would start low, but even 5 and above, I think I've done 4 of them a day. I've probably started at 2, but I've definitely gone up to 4 because I think it really makes a difference.
Yeah, I've put a 4-year-old on it, starting at, I think, 1 cap twice a day. In applesauce.
Thank you. How long would you recommend taking BDNF essentials?
Do you want to go and from an adult perspective? Or?
It really depends on symptom improvement, right? If you're following up with your patients, usually I'm seeing my patients every 7 to 11 weeks, and I usually will keep them on it for that time period. Check in with them and possibly longer. But I would say, if somebody held a gun to my head, I'd probably say, start with 3 months. Dr. Hamilton, what do you think?
I would say at least 3 months. I think the other thing is when people get better, if you're treating the infection, sometimes it takes longer to treat them. So say you're treating like mold for a year, you're probably going to need to have them on it for a much longer time, is how I think about it. And I feel like it's really safe and you're still kind of building that brain. But again, it's kind of symptomatic. But as I said, I think, being comfortable with using it as long as you need it, really, especially in these chronically, really sick kids or adults too.
The other thing that I would offer too is, when we're healing somebody from either, an environmental toxicity or just generalized inflammation, we have to remember that the mitochondria and the brain is mostly fat, right? You have that lipid bilayer there. And when you're healing nerves, like if you, were to sever your arm and have it surgically repaired, the surgeon is going to tell you it's going to take 9 to 12 months probably until the nerves heal. So when we're trying to improve neuroplasticity and things that are going on in the brain, I think a little bit of a longer term dosing strategy is prudent.
Okay, another question. I'm finding a lot of people with histamine intolerance, with anxiety and brain fog as major neural symptoms. Do you have any thoughts and protocols you like outside of just the low histamine diet and DAO when histamine intolerance is present? Have you seen a lot of cases? One study showed that 35% of people tested with anxiety qualified for histamine intolerance.
Yeah. Do you want to?
Yeah, I'll start and then you can go. So I gave a talk on this in October at A4M. Like half my slide deck was on histamine. So if you were there, go back and listen to that talk. I think DAO is great for helping with histamine that's coming from food, right? If you don't have diamine oxidase to help break down histamine, then it's going to be trouble for your patient. But remember, there's that other histamine pathway, the HNMT pathway, which is dependent on SAMe. I really like Histoqual a lot. I mean, there's a lot of histamine products out there, but I'm a big fan of Histoqual because it's got the Japanese basil in it. It's got the fisetin in it. There's good research on it, on those products. And yeah, Histoqual is probably my favorite histamine support. You've got to do other things too. You've got to figure out why are they having so many histamine responses. In my clinical experience, it's usually toxicity related because mast cells are going to do what mast cells do, which is degranulate in the presence of something that isn't supposed to be there, right? Whether it's endogenous or exogenous, those mast cells are going to release histamine, but then they're going to release all sorts of other things too. Mast cells have leukotriene B4 receptors on it, prostaglandin receptors on it, which are all super inflammatory. MMP9 receptors are on there. So you've got to really kind of, when I see patients like this, I have to think very broadly and really try and lower inflammation, control histamine, but really figure out where's the source coming from.
And there are a couple of questions that are fairly similar on this one, but it's this person says I work in a mental health facility. The rest of it's similar, and they rehab doing nutrition. So the question is, are these supplements okay with all the psych meds?
Right. I've actually looked in that. If you've looked into it. So I looked at the ingredients, and really the concern is sometimes a serotonin syndrome if you have too many things that affect serotonin. And when I kind of looked more into it in terms of ingredients, if someone was on multiple psychiatric medicines, like 2 or more, I'd be more concerned. But those on one medicine, in terms of interactions, do fine. And most likely also too, it depends on what you look at it. But when you're getting to the patients who are in like multiple antipsychotics and things like that, then I might worry more about interactions. But a lot of the antidepressants and some of the anxiolytics and stuff like that are fine with those. Dr. Wakely, I don't know if you have a different opinion or.
No, I completely agree with you.
Alrighty, and I guess this must be the same thing. Any side effects from BDNF, any dependence or tolerance issues?
I haven't seen any. I haven't seen any tolerance issues, and I haven't seen any dependence issues at all. It's healing.
Either way. It's calming. BDNF is calming too. It's a calming product. When I designed it, it was like, you don't want people who are like already anxious to be more anxious. So yeah.
How long would you recommend taking BDNF Essentials?
Yeah. I think we talked about that, really it depends on the symptoms, and especially these chronic patients. And, I'm thinking like 6 months, but you probably evaluate it 3 months and kind of go from there.
And what do you think about supplementing with DHEA if cortisol is high, or pregnenolone?
Yeah. I'll let the adult doctor do the hormones or the DHEA.
Yeah, I like DHEA. I think it can be really helpful as long as you're monitoring labs. Same thing with pregnenolone. I think pregnenolone is very, very healing for the brain. I think the dose needs to be right. But yeah, I'm a fan. I use them pretty frequently in males and females, both.
Mm-hmm.
Another question is dosages for word recall. I'm assuming this is the word recall that Dr. Hamilton mentioned in the study that they're asking about.
Right.
How much were people taking?
Right. It was 2 capsules twice a day. Although I've had people take 4 at night too. That's just an option.
And this is, I think, about the cold plunge idea. What about those who absolutely cannot tolerate, the cold exposure?
Well, if they can't tolerate any cold at all, I would look to sauna. Can they tolerate heat? And if you're trying to get them into do it slow. Sometimes when I talk about these things, I come off like I'm this very cavalier guy, but I've had patients move the dial on the shower like 5 degrees, and do that for a little while, and then go try and get a little bit colder.
One of the questions is, does the head have to be exposed to the cold, or is it just, below the neck?
That's an awesome question. I love that question. So in order, okay. I would say if we keep it simple, some cold exposure to the body is going to be better than no cold exposure. So if your patient is, it doesn't have to be an all or nothing thing, I guess is what I'm saying. If they're like, there's no way I can get my head wet. Okay, cool. I can only do my feet. Okay, awesome. Let them do their feet. And then maybe next time they come in, you can talk about, can we do knees? Can we try knees? When you get cold water on the face, that activates the mammalian dive reflex, which, golly, I was just looking at a paper on this like 2 or 3 weeks ago. And there's some interesting corollaries between brain health and the mammalian dive reflex. And that only happens when you get the face. But all that to say, just have them get some cold water on their body, even if it's just the bottom of the legs. It's better than nothing.
Thank you. And what do you think about HRT, for anxiety and depression?
Hormone replacement therapy?
Yes.
Yeah, it's a big deal. Yeah, it's a big deal. I mean, if you have I have a 26-year-old male patient in my practice right now, his total testosterone was, I think, 71. And we're seeing this more and more, right? I mean, LabCorp just changed the reference ranges. What was it, Dr. Hamilton? 2.5, 3 years ago, where the bottom end of the reference range now is 250 for total testosterone. Like if you have a total testosterone of 251, that's considered normal. That is the weirdest thing I have ever heard in my entire life. So yeah, absolutely HRT. And then for, postmenopausal women, perimenopausal women, and some even premenopausal women, you need to do HRT. Progesterone, even a little bit of bioidentical estrogen can be really helpful, but obviously go based on labs.
This question, these two are sort of related. It looks like, is BDNF helpful with sleeping? And what is the minimal dose you would start with BDNF essentials?
I mean, it's definitely helpful for sleeping. There's a lot of things in it that help cortisol. And I said it is very calming. If you want it more for sleep, you can do 4 just at night, as I mentioned before. We do have circadian PM, so that kind of works with BDNF essentials and anxieties. So I'm thinking about that for sleep. Is that in terms of dose?
And
Okay.
the other thing that I would just quickly offer is if somebody is having a hard time sleeping and it's due to restlessness or kind of what I call monkey mind, add in some histamine support. Give them 2 or 3 capsules of the Histoquel at the same time. That can really, really help people.
All right. Let's see. Somebody's asking, why do you use lipoic acid? They're saying alpha lipoic acid in the supplement, but I think it's R-lipoic. But anyway, I mean, Dr. Hamilton, I guess the question's for you.
Yeah, it's not in the supplement. Dr. Wakely mentioned it in terms of his regimen for that patient.
Okay, sorry.
And that was, that was for arsenic and the elevated aluminum, because alpha lipoic acid is a good chelator of transition metals.
Okay. Somebody wants to know what medications can improve BDNF. So I'm assuming these are maybe pharma products.
I don't know any pharma that's actually would help BDNF. Do you know any? I mean, I don't think there's any that's actually even targeted.
No, I don't know. I mean, my mind kind of went to some different peptides that are senolytic and supposed to increase BDNF, but there's no, I mean, at least to my knowledge, there's no human data on that right now. It's all animal model stuff, and I don't know.
Yeah.
Okay. Dr. Hamilton, this one's obviously for you. What kinds of symptoms does a 4-year-old present with?
In terms of anxiety or stress?
Yes, it doesn't specifically say that, but that's what I'm assuming. Yeah, with anxiety.
Yeah. I mean, kids, if a 4-year-old doesn't say, I'm anxious, Mom, they just act out. I mean, a lot of it's just really, behavior issues. And I call that quick rage, 0 to 60 kind of rage, just not tolerating things, one little thing, and they're just off. And then not sleeping, not eating, refusing to go to school, acting out in school. It's really looking at the behavioral kind of things. And that's when you start to look, I'm like, okay, what's nutritional? What's going on there in terms of what we can do to support in terms of calming. But I mean, ADHD, looking at those kind of classic symptoms are often, the big stress and anxiety piece.
Is it best to use the cold water therapy at night or in the morning? Doesn't matter.
Another awesome question. I'm loving these questions. So theoretically, it's not supposed to matter. Okay. But in my experience, and this is my personal experience, I do full body cold water immersion in the morning. And then at night, if I'm going to do any cold water, it's only from the knees down. And that's purely based on old naturopathic medicine, like allegories, from the 1800s, where if people were having a hard time sleeping, they would do what is called a goosh, which is, I guess, German for squirt. I don't know. I don't speak German, but just from the knee down with cold water, and that would help people sleep. So I don't do full body cold water at night because for me, it activates me. It makes me want to get up and do things.
Okay. Sort of related to that is what can one do to help lengthen deep sleep or this is funny, or decrease REM sleep? Maybe they meant increase REM sleep. They're going to lengthen deep sleep. So,
I mean, Dr. Hamilton, maybe you can confirm or deny what I'm about to say. I know there's been some research on CBN for helping increase, CBN for helping increase deep sleep. But that's all that's coming to mind for me.
Actually, their person came back, and they want to know about decreasing REM, because too much REM sleep throughout the whole night is not a great thing.
Yeah, because they're waking up unrefreshed because they've got too much mental. I mean, I would think about anxieties, BDNF, circadian PM, melatonin if they can tolerate it. If it doesn't give them nightmares, if they're already having too much REM, melatonin might be. I don't know. What do you think, Dr. Hamilton?
Yeah. I mean, if they're having dreams that are they're waking up a lot, I think about just anxiety and cortisol. So again, the anxiety is taking that cortisol down, BDNF essentials, really taking that cortisol down. So taking the stress levels down and moderating that to improve sleep I would think.
And I sound like a broken record here with the histamine stuff. I'm telling you guys, it's a big deal. If you have if your patients are restless or they're tossing and turning and flip-flopping, put them on Histoquell for a few months and see if that helps. I mean, I've had patients 4 caps before bed, super helpful.
That's interesting.
Yeah, I mean, the circadian PM, there are 2 herbs in the circadian PM that actually are targeting histamine to try to lower the histamine, because histamine literally elevated histamine activates the brain, so it keeps you awake. So and I use Histoquell too, as we talked a little bit about, but just adding that on top of the circadian PM would be good.
And I guess a little bit related to this is, how can we improve the cortisol awakening response?
Cortisol.
So in terms of I think of, basically making sure the cortisol is high in the morning. So getting their natural cortisol rhythm. And again, if you have the adaptogens, that's what they're doing. They're trying to kind of bring that cortisol, it's not too low, you're not burnout, you're not too high. So in terms of the anxieties, even the BDNF, they both have cortisol modulating. So either or both of those would be helpful.
Right. And I would also say routine, make sure that these patients are in a good sleep routine. If they're shift workers, that's going to be a lot of trouble. Get up in the morning, get some blue light exposure, some sunlight exposure, stop caffeine, around noon if they can, blue light blocking glasses at night, all the things. Sometimes you need all the things to help regulate cortisol. And sometimes we even have to put people on Cortef, 5 or 10 milligrams in the morning, or even 5 milligrams twice a day. If they're too low. Yeah.
The clarification on the 4-year-old is, what are the indications to use BDNF essential specifically in a 4-year-old?
And I said I use it, in patients who have a lot of behavior issues, but a lot of ADHD, kids with autism, any kind of traumatic brain injury. But those are usually kind of the things that I think of. I mean, just a lot of behavioral acting out stuff.
Right. All right. Well, we are out of time. We want to thank both of you, Dr. Hamilton and Dr. Wakely, for taking time out of your busy days to enlighten people and hopefully help practitioners and their patients. So thank you. Thank you, audience. We appreciate you joining us. Have a great evening, everybody.
Yep. Thank you. Take care.
Thank you, guys.
Bye-bye.
This was super fun.